Good afternoon, and thank you for joining us for part one of our webinar series on understanding the Inflation Reduction Act and upcoming changes to Medicare. We are so happy that each of you could join us for what we are sure to be an informative session. I am Tiara Green, President of Accessia Health, and your moderator for today. Before we get started, we just have a few housekeeping items to go over. First, all lines are muted throughout the duration of the webinar. However, we welcome you to submit any questions throughout the event through the Q&A section on the bottom of your screen. We will have time at the end of this presentation to answer as many questions as possible. For your convenience, the convenience of some of our viewers who may be hearing impaired, closed captioning has been turned on. This webinar is being recorded and it will be available on Accessia Health's website at www.accessiahealth.org. Accessia Health events, webinars, and conferences are intended to provide information to the public. The views and opinions expressed by any speakers or other third parties are not necessarily those of Accessia Health. And for those of you who may not be aware of Accessia Health or familiar, we are a national nonprofit, independent charitable assistance organization that assists individuals with rare and chronic conditions in accessing care. We are proud to have over 80 programs established in a variety of condition areas. Our assistance includes helping pay for health insurance premiums, co-pays for medications, and out-of-pocket costs such as co-pays to see physicians, laboratory testing, or diagnostic testing, as well as travel. In addition, we are pleased to offer educational opportunities such as these to provide individuals with information to make informed healthcare decisions. And without further ado, I'd like to introduce our speaker for today, Kristi Martin. Kristi is the Chief of Staff and Senior Advisor to the Deputy Administrator in the Center for Medicare. As a policy strategist, she draws on her decades of experience working in the public sector with private sector clients and in philanthropy. She was previously the Vice President for Healthcare at Arnold Ventures, where she led the philanthropy's prescription drug pricing portfolio, and was the Managing Director of Waxman Strategies Health Practice, where she worked alongside Congressman Henry Waxman, driving toward progressive outcomes in health policy. Kristi served several years in the U.S. Department of Health and Human Services, Office of Personnel Management, and Government Accountability Office. As a senior advisor in the Obama administration's Office of Health Reform, she had primary oversight responsibility for the coordinated and timely implementation of cross-cutting departmental public health and prevention initiatives under the Affordable Care Act, including addressing the rising cost of drugs and setting up the Women's Preventive Services Initiative. Kristi received her bachelor's and master's in health communication from the University of Kentucky and a master's of public administration from George Washington University. Welcome, Kristi, and thank you for joining us.
Thank you so much for having me. I'm really excited to share with you what all the Inflation Reduction has to offer and kind of like what answer some questions and what people should be really keeping their eyes on and certain changes that are coming, especially for next year. So we can advance the slide. So one thing that I want to kind of get across today is there's been a number of changes as a result of the prescription drug law, also known as the Inflation Reduction Act. And I'm going to go through kind of each of those provisions. They click into implementation at different points in time. So it's really important to pay attention to the ones that went into effect in 23, 24. Some of them are going into effect in January of 25. And we also have some going into effect in 2026. So I'll walk through some of that and really talk through how do these changes improve affordability of prescription drugs, both for the Medicare program, as well as people with Medicare, and then go through some of the resources that we have put out. Next slide. The Inflation Reduction Act was signed into law in August of 2022, and the law really does provide meaningful relief for millions of people with Medicare. by improving not only their access to affordable treatments, but also by strengthening the Medicare program both now and in the future. The law makes improvements to Medicare that expands the benefits, really enriching the benefit for people with Medicare that helps to lower their drug cost and improve sustainability of the program over time. Next slide. There's a number of provisions in the drug law that are important for people with Medicare. One, Medicare now has the ability to negotiate the price of certain high expenditure drugs with manufacturers directly. Two, the law provides ACIP recommended adult vaccines now for free under the Medicare Part D prescription drug coverage. Three, the law makes Medicare Part D prescription drug coverage more affordable by instituting a true out-of-pocket cap, and I'll talk more about that. Four, it also places a $35 per month out-of-pocket cap for each covered insulin in Medicare. This includes both insulins that you receive through the Medicare Part D prescription drug program, but also insulins that are received under the Part B or your Medicare Advantage plan. And finally, it requires manufacturers to pay rebates to Medicare if they increase their prices faster than the rate of inflation for certain drugs. Next slide. So as I mentioned, different things go into effect at different points in time. This year in 2024, we had a couple of improvements that were made. One, people with very high prescription drug costs no longer have to pay out of pocket once they reach what's called the Part D catastrophic phase. And for a lot of people, that's around $3,500. Also in 2024, eligibility for the full low-income subsidy, or what we call the Extra Help program, has been expanded to people with incomes up to 150% of the federal poverty level and that have limited resources. This program helps to lower premiums and out-of-pocket costs for prescription drug coverage for those who are enrolled. We know that there are a lot of people who may be eligible for this program, but not yet enrolled. And what we're looking forward to for 2025, and these provisions will start on January 1st. Everyone with Medicare prescription drug coverage, so everyone enrolled in a Part D plan or has a Part D plan through their Medicare Advantage plan, will now have a $2,000 annual out-of-pocket cap on their prescription drug cost. Also in 2025, people with Medicare Part D will have the option to manage their drug costs by spreading them over the year through monthly payments. So not helping necessarily to save money, but really helping with cash management and to spread those maybe high upfront costs over the year. Next slide. So I'm going to talk a little bit first about the Medicare prescription drug price negotiation program, and it's Medicare's ability to negotiate directly with manufacturers on prescription drugs. So as I mentioned, Medicare now has the authority to directly negotiate with drug companies to improve the access and cost of some of the highest cost drugs in the Medicare Part B and Part D program. Last year in August, we announced the first 10 drugs covered under Part D that were selected for negotiation. These were the drugs that were among the highest spending drugs in the Medicare program. In October, we announced that all the manufacturers of these drugs signed agreements to participate in negotiations with Medicare. Next slide. And this actually needs to be updated. We actually completed negotiations late this summer. And on August 15th, we announced the 10 prices that were agreed to between Medicare and participating drug companies for these 10 drugs. We were very excited in that these drugs would have saved Medicare money if they had been in place last year. And more importantly, I believe, they will save Medicare beneficiaries $1.5 billion when they go into effect in 2026. CMS will also be selecting next year up to an additional 15 drugs covered under the Part D program for negotiation. And we will continue every year selecting more drugs with an additional 15 the following year, which could also include Part B drugs. And then for subsequent years, we will be selecting up to 20 drugs. Next slide. So these agreed to prices that we agreed to and that were announced in August are very important. This is the timeline of how the process worked through. And I think the most important thing for people to know today is that we've negotiated these prices. We came to agreement with the manufacturers, and these prices go into effect on January 1, 2026. So they won't be going into effect next year, but the following year. And that's so that they can get incorporated into the Part D plan process and be incorporated into the plans themselves. Next slide. So next, I want to talk about the Medicare Prescription Drug Inflation Rebate Program. Next slide. So this program requires that drug companies that raise prices for certain drugs covered under Part B and Part D faster than the rate of inflation to pay Medicare a rebate that goes into the trust fund. CMS will begin invoicing prescription drug companies for the rebates that they owe to Medicare no later than the fall of 2025. And as I mentioned, the rebates paid by these companies will be deposited into the Federal Supplementary Medical Insurance Trust Fund. This trust fund helps to ensure long-term sustainability of the Medicare program for future generations. The rebates are actually calculated on a quarterly basis for Part B drugs and an annual basis on Part D drugs. And as I mentioned, we will begin invoicing the amounts owed next year. Next slide. Next, I want to talk a little bit more about the Part D improvements, how the law is really enriching the benefit of the Part D prescription drug program, and what people can expect in the more immediate term. So first, this year, starting in January, Medicare Part D plans had a new cap in place on annual out-of-pocket prescription drug costs in the Part D prescription drug program, that when a beneficiary reaches the catastrophic coverage phase or the catastrophic threshold, which begins at a threshold of $8,000, it's what's called the true out-of-pocket cost. And when they hit that, then they would no longer pay out-of-pocket cost. But due to how the Part D program is constructed and the standard benefit is designed, most people will contribute roughly between $3,300 and $3,800 toward the cap of $8,000, and then pay $0 for Part D prescription drugs for the remainder of this year. We are very excited about this provision. We've heard numerous stories about how this is really helping people save money on their prescription drugs. And so we've been very excited at the implementation for this one. Next slide. And even next year, the benefit will get richer. So in 2025, starting in January, everyone who is enrolled in a Medicare prescription drug program plan, this includes a standalone Part D plan or a Part D plan that is connected to a Medicare Advantage plan, will pay $2,000 out of pocket for their prescription drugs. So this will apply to everyone who is enrolled in Medicare Part D prescription drug coverage. This is the first time that we will have any such cap on benefits like this in the program, and we are very excited about the meaningful financial release this will provide to millions of people. Also, for the first time in 2025, all Medicare prescription drug plans are going to have to offer their enrollees the option to pay out-of-pocket prescription drug costs in the form of monthly payments instead of perhaps all at once at the pharmacy counter. The next set of slides will go into more detail on that program. So let's move on. So Medicare prescription payment plan. So the Inflation Reduction Act, as I mentioned, requires all Medicare drug plans to offer the option to beneficiaries to pay out-of-pocket drug costs in monthly payments instead of all at once at the pharmacy. This program goes into effect January 1st, 2025. And the way it works is if someone opts into this program, the participant would pay $0 to the pharmacy for the Part D drugs at the counter. And then Part D plan sponsors or their Part D plan will then bill the participant monthly for the cost sharing that they would have incurred while in the program. Pharmacies will be paid in full by the Part D plan in accordance with the Part D prompt payment requirements. And these enrollees with high cost sharing earlier in the calendar year are the ones who are most likely to benefit from the program. And I cannot stress enough how important this is. The Inflation Reduction Act provides several provisions that help to save people money. The $2,000 out-of-pocket cap is one, the $35 cap on insulin, the no-cost vaccines, expansion of the Extra Help program, which helps to pay for premiums and out-of-pocket costs. The Medicare prescription payment plan helps to smooth out those costs over the year. So really helping to manage more of the cash flow of the costs that are incurred versus lowering the cost of the drugs. And so for people who are eligible for other coverage or other help, like the Extra Help program or the Medicare savings plans, enrollment in Extra Help actually may be more advantageous than enrolling in the Medicare prescription payment plan. And I pulled up a few examples to help walk through this. So we'll move to the next slide. So in example one, let's say that Juan starts the payment plan in January at the beginning of his plan year. He fills a prescription each month that costs him $500. So because he's elected to be in the plan, and over time, he will meet the $2,000 out-of-pocket cap, which you can see in the first column, then all of his cost sharing for the year would be incurred by April. But if that $500 each month is too hard for him to afford at the time, then he can elect to be in the prescription payment plan, and you will see that his costs for the month are spread out over time. So his total is still $2,000 for the year, his maximum out of pocket. However, each month is a little bit more affordable in that $2,000 has been spread out over time. And so the math is not necessarily, I think, easy to follow. So like we thought walking through an example might be helpful. So one might be somebody who would benefit from the program because he has high upfront out-of-pocket costs at the beginning of the year. He knows he has those costs and he's going to meet the out-of-pocket. So let's go on to the next slide. So this is an example of Carmen, and Carmen takes several drugs. They reach about $80 out of pocket each month. She started participating in January also, and her first fill at the pharmacy was in January. And you can see in her first fill, it was $80. And then she's elected to be in the program. Her total for the whole year in spending is $960. So she is not going to meet the $2,000 out-of-pocket cap. And so after the first month, the calculations are programmed differently so that as you smooth out the cost, that cost could get additive over time. So while her first payment could be $80, her last payment could be up to $241. And so she would need to make a decision, is this the best option for her? And this is why people have the ability to opt into the Medicare prescription payment plan, because it's really trying to figure out, is this the right thing for them? They can talk to their plan, their Part D plan, to kind of figure out if this is the best option. Next slide. So really excited about this year, the expansion of the Extra Help program. As I mentioned, the law expanded the eligibility for the full income, low income subsidy, and then what we call Extra Help to individuals with limited resources up to 150% of the federal poverty level. So starting in January, nearly 300,000 people with Medicare already enrolled in the Extra Help program because of these newly expanded benefits. And this means they have access to plans that have no deductible, no premiums, and fixed lower copay costs for certain medications. We also know that there's an additional 3 million people who are enrolled in Medicare who could benefit for Extra Help, but they are not currently enrolled to receive Extra Help. So we would all want to make sure that people are aware that this benefit exists and that people should be looking to see if they're eligible for it, because it truly saves them money on their prescription drug cost. Next slide. So a little bit of how this works. So in 2024, most people who qualify for Extra Help will pay $0 for a Medicare drug plan premium, $0 for their plan deductible, up to $450 for each generic drug, and up to $1120 for each brand name drug. So significant savings from their prescription drug costs. And this is all about, signing up and making sure that if you're eligible for the program, you have enrolled, and you enroll with the Social Security Administration into this program. Next slide. So there's also additional savings for people with Medicare. I just want to quickly highlight. The first of those is, as I mentioned, the law made ACIP recommended adult vaccines free under Medicare Part D prescription drug coverage. This is very exciting. You know, there's about 10 million people with Part D who received a free vaccine in 2023. And these vaccines include vaccines like shingles or RSV or other recommended vaccines. A lot of people on Medicare end up getting Tdap booster for whooping cough whenever they have new grandbabies. And vaccines that are like flu, COVID, and for pneumonia are covered under the Part B program, also without cost sharing. And so this really does make sure that the broad spectrum of vaccines are available for people in Medicare at an affordable cost. Also under the Inflation Reduction Act, state Medicaid and CHIP programs were also required to provide coverage for approved adult vaccines recommended by ACIP without cost sharing. So really trying to synchronize all across all of our programs, the availability of free vaccines. Next slide. The other one that I mentioned a little bit earlier was that in 2023, the law ensured that people with Medicare pay no more than $35 per month for a month's supply of each covered insulin product under Medicare prescription drug coverage, traditional Medicare, and Medicare Advantage. So whether you use your insulin and you get it through a pen, a syringe, you use it with your pump, those are all now capped at $35 a month for a month's supply if they're covered under Medicare. Next slide. We have produced a number of resources that are useful for helping to educate people about the new benefits under the Inflation Reduction Act and the improvements in Medicare. Next slide. So resources that are available can be found on our CMS IRA page, and you can see the link to the bottom. We have fact sheets, we have timelines so people can really understand what the programs are. Also opportunities for, submitting public comment on policy documents that are currently open. So in the Medicare drug price negotiation program, we have information on the negotiations we just completed. We also have information on the negotiations that are going to be coming up next year for the next cycle, which will be up to 15 Part D drugs. Next slide. For the inflation rebate program, we have a number of resources that are helpful. We have resources that are on the program itself and the policy. We also have information every quarter on reduced coinsurance for certain Part B drugs under the inflation rebate program. So whenever a company increases their price faster than inflation under Part B, which are physician administered drugs generally, the coinsurance is adjusted to no more than that difference in inflation from quarter to quarter. So typically, coinsurance for Part B drugs is 20% of the cost of the drug. And with the reduced coinsurance, that means that some of those drugs would have a coinsurance less than 20% because the company increased their price faster than inflation. So every quarter, we publish a list, not only of the drugs that have the reduced coinsurance, but also how much their coinsurance is for that quarter. Next slide. We also have a number of resources for the Medicare prescription payment plan. We have fact sheets, we have takeaway cards. We also have information in the new Medicare and New Handbook, which just was delivered to people in September. We mailed out 46 million print copies, 3 million electronic copies. We also have on Medicare.gov information about the program. We have a wizard that includes a few key questions to help figure out if maybe the program is a good fit for them and gives them some resources to help also enroll in the program by calling their plan. And really about figuring out, is the prescription payment plan the right choice? We also have Medicare Plan Finder improvements that have happened over the year. As many of you might know, we're currently in the shopping period for Medicare open enrollment. It's a very exciting time of the year when people can look at their plans and make sure that they're enrolled and the right plans under Medicare, whether they're in traditional Medicare, Medicare Advantage, Part D, really making sure that their health needs are being met by their plan. And it's a good opportunity to know that things have changed, plans change, people change, and make sure they're shopping to make sure they have a plan that fits their needs at the time. And so on the Medicare Plan Finder, we have a number of improvements that will be a part of the open enrollment, which begins October 15th and goes through December 7th. And one is including a cost preview feature that allows people to compare their monthly costs with and without the Medicare prescription payment plan. So that can help them figure out if it may be a good fit for them. We have also general education videos, both in English and in Spanish. And we have a number of partner trainings through our national training program at CMS that are available for anyone to view. Next slide. And then the vaccines. I think we are really looking to help spread the word. We're currently getting into flu and COVID seasons where people need to get their boosters for these very important life-saving vaccines. We have a number of postcards and informational items that people can share to talk about getting their vaccines, making sure that they have them when they need them to protect themselves from disease and serious illness. And so those are available on our CMS website. We also have information available on Medicare.gov, and people can also call 1-800-Medicare to get more information. Next slide. And extra help. We have a number of resources for extra help that can be useful for folks. One, we actually have an extra help website to get a lot of new information. We have postcards, we have fact sheets. We also have drop-in articles. So those are really made so that people can use them and repurpose them into like their own newsletters, or getting information out to their constituents and the people that they work most closely with, that are very easy to access. And so we have a number of resources that are on our cms.gov page on those. Next slide. And as I mentioned before, insulin. Again, we have a lot of resources for insulin. We have social media toolkit. We have postcards. We have a drop-in article for that. So there's a lot of things that people can use to help spread the word about different improvements that have been made to Medicare, ways that the provisions in the Inflation Reduction Act help people save money for their prescription drug coverage and those prescription out-of-pocket costs. And so we have them individualized to the specific provisions, and then we have some general pieces as well. Next slide. And here's some more information on our partner resources. The newsroom includes a lot of our fact sheets. We also have the resources I've mentioned on the second, the CMS.gov Inflation Reduction Act and Medicare. And we're really excited for people to help us get the word out. We know that right now is a good opportunity with open enrollment right around the corner to talk about how Medicare is changing, and really encourage people to go to Medicare.gov, call 1-800-Medicare, and make sure that they are in the right plan for them. And then other beneficiary resources, just a reminder, the official source for Medicare is Medicare.gov and 1-800-Medicare. It is really important to make sure that people know these are the official sources of information for the Medicare program. In addition to that, if people would like in-person help, there are the state health insurance assistance programs, also known as the SHIPs. They provide free in-person counseling. They are fantastic, and you can find out more about your state office by going to shiphelp.org. And they can provide, as I said, in-person assistance for folks. And just some final takeaways that I think would be helpful as reminders. There's a number of things that are happening under the Inflation Reduction Act to really improve Medicare, for not only making drugs more affordable and accessible for people with Medicare, but also really helping with the sustainability of the program for now and in the future. And I talked a little bit about the negotiation program, which is allowing Medicare to negotiate the price of drugs for the first time. Also, the capping of out-of-pocket costs in the Part D program. Right now, costs are capped at about $3,500 for 2024. But in 2025, the cap will be $2,000 for everyone. And people will also have an option to manage their drug costs over the course of the year, versus facing those high drug costs at the beginning of the year. Medicare covered insulins are available at $35 or less for each month's supply, and the deductible does not apply. Similarly, ACIP recommended vaccines are available to people with Medicare and adults with Medicaid without cost sharing, and no deductible applies. And then finally, but very important, the new law expanded the eligibility for the Extra Help program to individuals with limited resources and incomes up to $150 of the federal poverty level. That's again 3 million people that are eligible for this program to get help with their premiums and their drug costs who are not yet enrolled. So really trying to find those people and make sure that they know that they're eligible and helping them to enroll through the Social Security Administration. Next slide. And just asking for everybody, you know, help to share resources, help to spread the word of all these improvements to Medicare. Make sure people know that during open enrollment, they're going to have an opportunity to take a look at their plan to make sure it's the right fit for them. And then every year plans change and people change and their needs change. But this year with the $2,000 out-of-pocket cap going into effect in 2025 is really important for people to take a look to make sure their plan meets their needs. We always welcome for people to share feedback about resources and things that may be helpful. We have provided a number of our resources in different languages, English, Spanish, Vietnamese, Chinese, Tagalog, to make sure that we're reaching audiences that we need to reach. And we want to, at the end of the day, our primary goal is to make sure people are aware and able to take advantage of these amazing benefits to help lower their prescription drug cost. Next slide. And I think I turned it back over to Tiara.
Thank you so much, Kristi, for giving that great information, very informative. We're going to open it up for some questions. We have a good bit of questions, and you also see on the screen a QR code. If you have not done so already, we invite you to register for Part 2 next week on October 10th. Our speaker for that event will be William Sorrell, and he is a recognized legal expert in healthcare and life sciences. I am ready to take some of these questions, and we'll start with a calculator. Everyone is wondering, will there be some sort of tool that they can use to determine their cost if they choose to go under the Medicare prescription payment plan?
Yeah, thank you for that. And I think that's a great question. So we have a couple of resources that I mentioned very briefly. I can go into those in a little bit more detail. So first, on Medicare.gov, we have what we're calling the Medicare Prescription Payment Plan Wizard, which is a very simple tool. It asks a couple of questions. For example, do you have extra help? Are you enrolled in a Medicare savings program? And then once you answer a couple of those questions, it will say whether it's likely that you're going to be most to benefit from the enrolling in the Medicare prescription payment plan or not. So it gives you a general sense of like, is this the right thing for me or not? And then it will give you instructions, most importantly, to call your plan and talk to them, because everybody's prescription drugs are very personal to their situation that they're in. And that cost sharing is very, very individualized to them. You know, which pharmacy are they getting their drugs from? How many drugs are they on? Are they on one drug? Are they on 5 drugs? We know most people in Medicare are on anywhere from 5 to 8. And so really trying to take some of those very individualistic pieces and helping to inform them on how much their monthly cost could potentially be. Second, in the Medicare Plan Finder this year, which we've just started shopping period, excitingly enough, just started this week, started on October 1. And the actual open enrollment starts October 15th. Within Plan Finder, when you go through the process of selecting your drugs and picking a pharmacy and start shopping for plans, there is a button that you can turn on and turn off how the Medicare prescription payment plan would affect your cost sharing based on those criteria that you've selected about what drugs you're interested in covering and what plan you're looking at and what pharmacy you may be going to. And it'll show you what would your cost sharing be with potentially the prescription payment plan and what would it be without it on a monthly basis. So that tool is going to be a little bit more individualistic than the wizard because it is taking into account specific plans and specific drugs as well as pharmacies. Third, you can call 1-800-Medicare or more importantly, call your plan and talk to them about what you think your experience might be for 2025. And they can help to calculate to see what the prescription payment plan monthly payments would be. And then that's where you would enroll, is with your plan. So we have a number of different tools and resources that we're presenting for people to use. I think the calculator is somewhere in between like the wizard and what have been embedded on Plan Finder. But as I mentioned, because of the individualistic nature of like, what plan are you enrolled in? What drugs are you on? What pharmacy are you going to? That can be very different from person to person. So the most important thing is to call your plan and ask them about what your monthly cost could be.
Thank you, Kristi. I was jotting down my own notes so that I can check out the wizard as well. Can patients opt into the payment plan at any time throughout the calendar year, or is it only available during that open enrollment period?
No, they can opt in at any time, and they can opt out at any time as well. So it's completely up to them on that decision, and they call their plan to do that.
Great. They're asking for the link to the tool that you mentioned, so that they can take a look at that. Is that live at this time?
It is live, and I don't have it off the top of my head, but TR, I can share it with you, and maybe you can include it
Perfect.
on some information afterwards. I can include both some of the more specific pages on Medicare.gov on the prescription payment plan that has a link to the wizard, and then also maybe some other pages that might be interesting for folks.
Perfect. We'll be happy to share those. Do we know what the drug cost for extra help for generic and brand name medications will be for 2025?
We do. I don't think we probably do know that. I would have to look that up. It would have been
Okay.
published in the Part C and D final rule.
Mhm.
But I would have to get that to you. And I can send that as a follow-up.
Perfect. For medications that are covered under a Part D plan, does it mean that if there are other prescriptions that need to be filled, they will be covered at 100% if they are opted in for the Medicare prescription payment plan? So if,
Yeah. So the way
okay,
it works here, that's a great question. So you either opt in for all of your drugs or you're opt
mhm,
out for all your drugs. So it's not based on a drug by drug basis. So let's say, for example, I'm on a drug like a statin, and I go into the
okay,
plan here knowing that, right? And then you never know, things change. Healthcare can be unpredictable. Your health can be
mhm,
unpredictable. And let's say later in the year that I have something that requires a higher cost drug, and I'm like a little sticker shock. So what would happen is the statin that I'm on, along with this other one, if I opted in mid-year, that statin monthly cost sharing from the time I opted in would get put into the monthly payment. So it's all your drugs are added to that monthly payment.
got it. And will individuals have to opt in year over year? So let's say they opt in 2025, 2026 rolls around, will they need to opt in again?
Yes, and part of that's because of the way open enrollment works, and that people are changing plans, can be potentially changing plans every year. And so, at least for now, yes, opting in would be each year.
Okay. We have another question. It's my understanding that certain enhanced Part D benefits count toward the annual out-of-pocket cap, such as low copays, coinsurance, deductibles compared to basic plans. So could it be the case that someone with one of those plans would hit the annual cap at some point before they've spent the $2,000 out of their own pockets?
Yes, that is a fantastic question. So there are Part D plans that are called enhanced plans, and those enhanced alternative plans actually have a money toward that out of pocket cost, right? And so the way that might be best way to talk about it is no, everyone in the Medicare Part D program who is enrolled will pay no more than $2,000 in 2025 for the prescription drug out of pocket cost. And so there are definitely situations where we think people would have a maximum within their plan that may be less than a 2,000.
Thank you. So we're going to shift a little here to the medications or the drugs with negotiated prices. How will the public know which drugs are part of the new price contracts?
That's a great question. So for the first year, we selected 10 drugs. We published them on cms.gov when they're selected for negotiation. So these were published last August. And then we published the prices that were agreed to between the manufacturers and Medicare this past August. And so those prices go into effect in 2026. So we're still a little bit away from like those prices going into the Medicare program and into the Part D prescription drug coverage. So right now they're published on CMS.gov. I think we're still working through if there's anything else we need to be thinking about as we get toward open enrollment next year, preparing for the 2026 plans. But people can find all the information, like what indications do they cover, how many people in Medicare are on these drugs, how much is the Medicare spending for each of these drugs, the negotiated price that was agreed to, can be found on CMS.gov. And I can send you the link to that one too.
Great, thank you. I think many people are hearing more and more about the $2,000 prescription cap for Part D, excited about it. This is a question on, they're starting to hear that insurance companies will compensate for their loss in income by increasing Part B premiums. Is there anything that is going to be done to keep the Part B premiums at a lower cost?
Well, the good thing is the Part B premiums are based on actual fee-for-service inputs. And so they're not really a connection between Part B and Part D. But I do want to note that we just announced the premiums for 2025 last Friday, I think. Time is a little fluid. Last Friday, and we were excited to note that premiums are down this year for Part D and for Medicare Advantage. We're very excited about that. So if the benefits are enriching, premiums are stable. The program is very stable. And so people, I think, overall should be like really excited that they might be seeing lower premiums when they go in. They also have these added benefits and improved and enhancements to the program itself. And so we're just really excited that drugs are going to become more affordable.
Great. Does the payment plan include the deductible?
That is a great question. So the payment plan is your all-in out-of-pocket cost. So if there's money being paid out of pocket, that could get included in the prescription payment plan. So if you do have a deductible, if you're paying 100% toward towards your cost and the deductible, that can get included and that can get spread out over time.
Great. Okay. So we have some social workers on the call, those that are working hand in hand with those Medicare beneficiaries and helping them to navigate this space. What is the role that social workers and caregivers can help with members in enrolling and saving money on some of these programs?
I think the first thing you can do is I've named a number of different programs that people will honestly be helped and they can save money on their prescription drugs. So as you're working with people, asking if they're enrolled in the extra help program, do they qualify for it? Helping them to figure out if they're eligible and getting them enrolled. The same things with the Medicare Savings Plan, Medicare Savings Program, The Medicare Savings Programs are state programs that also help to lower costs for people who meet certain income requirements. Those programs are just so critical. And we know that there's people who are eligible and not enrolled. So I would say that's the first thing, really helping people to understand if there's something that they're eligible for, getting them enrolled and helping them to do that. The second thing is taking advantage of open enrollment. We have an incredible opportunity between October 15th and December 7th to go shopping, to really see what is this plan the right plan for me? Do I need to change things because my health has changed over the year, because something else, might have come up, because my circumstances change, right. Maybe I, want to spend less money on my healthcare, more money on my healthcare. A lot of things kind of impact how people make decisions. So really encouraging them during open enrollment, go and compare your plan options. Go and see if your Medicare that you currently have is the right fit for you. And I think third is making sure that, we're always worried about fraud and abuse in the program, making sure people know that, 1-800-Medicare and Medicare.gov are the official sources for information about the Medicare program. If they have questions, those are great places for them to start. And really the first place they should go and trust, as long as the state health insurance assistance programs are the SHIPs, really helping them to navigate to trusted official sources.
That's very helpful. I know you shared some of the resources that are out there. We have some questions on, is this going to be included in the plans information that they send out to those enrolled?
Yeah, so we approve a number of model plan notices is what we call them, but materials that plans share with their enrollees. We approve a number of those throughout the year, kind of gearing up toward open enrollment. So notices on the Medicare prescription payment plan, on all the materials that beneficiaries receive, such as explaining benefits. We include information on the extra help program, the Medicare savings programs. And so really trying to incorporate that, where people go to get information, where do people like trying to get notice on benefits and on improvements in the Medicare program. We do have that information throughout a lot of the model plan notices that we have approved and that plans will be using.
Great. Does the pharmacy have any responsibility in communicating the option available when an individual is filling a prescription?
Yes. So in our guidance that we published earlier this year, we talk a lot about what is the plan's responsibility to give information to beneficiaries who are most likely to benefit. But also we have approved a notice that can be handed out at the pharmacy counter. So if a person goes to a pharmacy counter and they have a certain threshold of their out-of-pocket cost, the pharmacist would say, hey, have you heard about the Medicare prescription payment plan? And give them a notice, a one-page notice to give more information about whether that would be good for them, and then refer them to their plan to talk to their plan about whether it's the right choice.
Great. That's great. Thank you. Is there a chat option on the website to chat live with someone at CMS if they're having questions or difficulties?
That is a great question. I just tell people to call 1-800-Medicare. I'm looking right now, Tiara, because I was just like, that is a great question. I would just suggest people call 1-800-Medicare. They're available 24/7. They are a group of amazing people. Wait times are very short, if any. And so that's really the best place is just call somebody and they can really help and talk through it with you.
Great. Are there any handouts for pharmacies that they can utilize?
I think all of our resources can be used by a variety of different stakeholders and for
Okay.
different audiences. So, I mentioned that we did some postcards. So we have postcards and fact sheets. The postcards and fact sheets could be hung up in a doctor's office I know some of the social workers that are on, they could print out a couple of them and hand them out, or hang them up at the pharmacies or put them into leave behind, sometimes they drop in your white bag, they'll drop something into your white bag
Yes.
with some information. So all those resources, we really try to think about one, what are the different types of resources people are most likely to use? Postcards, fact sheets, drop-in articles are really popular. And number two, thinking about languages. And so we've translated a number of those materials, including the postcards, into English, Spanish, Vietnamese, Chinese, and Tagalog. So having those available in different languages to meet different audiences' needs.
Great. And still staying on that pharmacy side, we have a question on, can it be a pharmacy tech that is providing the education to the individual, or does it have to be a registered pharmacist?
It does not. It's really a requirement on the pharmacy. So really about when a person goes to that counter, is that notice getting provided to the person, to the Medicare beneficiary. So it really doesn't matter who is doing it necessarily. It's really about where it is happening and when it's happening.
Great. We have, we mentioned there are social workers on here, and some of them are working in the oncology space, right?
Mhm.
We are dealing with those chronic conditions. Can you tell us a bit more about those medications that are infused and may be under Part B and not necessarily Part D? And are they subject to a maximum amount?
Yeah, that's a great question. And just want to thank them. I got started in my career at the National Cancer Institute and the American Cancer Society. So oncology and cancer care is very close to my heart for a lot of reasons. So just want to thank them for all the work that they are doing. I know that they are not told enough how valued they are. So when it comes to Part B, I think a couple of things. The out-of-pocket cost that I mentioned, the maximum out-of-pocket cost, only applies to Medicare Part D as in drug. For Medicare Part B, there is no out-of-pocket max, but there are some other things that are happening that hopefully will help to make drugs more affordable. One is the reduced coinsurance that as a result of the inflation reduction, inflation rebate program. Some of the drugs that are on that list each quarter are oncology drugs or drugs that are used to support people with cancer. So they may not be an oncology drug themselves, but there's something like that people will need as they're going through cancer treatment. So that will help to reduce costs for people. The second one is, ultimately with the inflation rebates, the whole point of the Medicare inflation rebate program is really to help per price increases. So those ASP, average sales price, which is how much we pay for drugs, each drug in the Medicare Part B program, is maybe not rising as fast as it once was. And that's what their coinsurance is based off of. So if like those average sales price or prices in the Medicare Part B program stabilize, then people's costs won't go up. And then the third, starting in 2028, for the third cycle of negotiation, which will select those drugs in 26, Part B drugs will become eligible for being selected for the negotiation program. So that may offer in the future another opportunity to save some money on those very important Part B drugs.
Yes. So I think it gets confusing for beneficiaries as they're looking at plan choices and are my medications Part B or Part D? Can they take these, and this is a direct question, can they take these Part B drugs and go through Part D? What is preventing them from just going through Part B instead of D, or D versus B?
Yeah, it really depends on how they're available in the market. So Part D drugs are drugs that are typically self-administered. They are drugs that are available at a retail pharmacy, a mail order pharmacy, like where you go and pick them up and take them, right? Versus Part B as in boy drugs are physician administered, meaning you have to go to a doctor's office, an infusion clinic, you have to go somewhere to get those drugs. So typically the way that the drugs are defined makes a difference. There are drugs that cross over though. I think a good example is drugs that used to maybe in the past they were infused and you had to go somewhere and get that infusion. And now they're in a self-administered pen. And so, you think of a lot of drugs for like arthritis that kind of have moved into that space. So there are some drugs. The best thing that I think people, and one of the operational improvements to Plan Finder, which I'm really excited about, is if you put in your drugs this year during open enrollment and after, so let's say you have 5 drugs and like maybe one of those drugs you've been getting in Part B, you can put it in. When you have the side-by-side comparison of plans, it will clearly indicate whether a drug is not covered by the plan. And there'll be a label on it, which will make it easier to compare. So you can really start to look at like, oh, if I'm looking at 6 plans, one of them doesn't have all my drugs covered. It'll be very clearly indicated. And I think that'll help people with the shopping experience. So, there's new tools that we're rolling out. We're really excited about to help people figure out about their drugs.
Thank you. That's exciting. I love all the enhancements to the website and tools that puts the information right at the user's fingertips. This is a question from a participant. I have a private plan. Do I have to get a Part D plan?
No, a Part D plan is optional. People can choose to get it during open enrollment or not. And if they have a private plan, like for example, if they are still working and they're eligible for Medicare, a Part D plan, they can wait on that one. They won't be penalized. So if they have coverage that works for them, that's fantastic. If they have any questions about if there would be, for example, in Part B, a penalty applied if they chose to not to elect to get into the Part B or Part A, they can always talk to 1-800-Medicare, or they can call a SHIP to help them talk through some of those options about what's best for them.
Great. What percentage of patients does CMS anticipate hitting their $2,000 out of pocket this upcoming year?
That is a great question. I don't know if I know the percentage off the top of my head. We are anticipating it will be around 10 million people, though.
Wow. Wow. So this is a huge improvement for many beneficiaries.
Yeah. A lot of people are going to benefit from this. And because it's like a change to the program going forward, that $2,000 maximum out-of-pocket cost will be adjusted by inflation over the year, but it's in the program now. And so like if you don't meet that $2,000, maybe this next year,
Sure.
there may be a time when you do, and that cap, that maximum out-of-pocket cap will be there whenever you need it.
Great. Some have been informed by patient assistance programs that they will be required to enroll in the Extra Help program and get a full denial letter in order to apply for patient assistance programs. This will cause additional stress on the elderly. Can you shed any light on this? And I'll answer this from a independent charitable patient assistance perspective, in that I know we do not require anyone to apply for an Extra Help program. That is the decision of the individual, and it's freedom of choice.
And I think if anybody is getting these letters, we would love to see them. I think we are, as you said, Tiara, the Medicare prescription payment plan, the Extra Help, Medicare savings program, those are programs available to people if they want to opt into them. There's no
Yes.
requirement to sign up. We would encourage people for Extra Help and for the Medicare savings program. We definitely encourage people because it will save them money over time. But I think they have to make those choices for
That's
themselves. So
right.
we do not require people to sign up for those. And if people are having issues, I'd welcome, send us some more detail about that. I think we would love to take a look at it.
Thank you for asking that question. We appreciate that. Is there a formula or a way that CMS is actually calculating the cost that someone has to pay under the Medicare prescription plan? Or is it, just based on the medications?
There is a formula. It's very complicated. It was in the law. I am probably not the best person to speak about it because it is way beyond my math skills. But we put out a technical guidance about a little over a year ago, in the summer of 2023, walking through how the calculations that were laid out in the law, how those work. And that's where I pulled those examples from, because we needed to provide examples to educate people on how they were working because it's very complicated. And so, yes, we have actually technical information that is out there about exactly how that math works and how that math can be different from one scenario to another. And how, as I showed you in that second, that there could be like an escalating of the monthly payment at the end of the year based on when somebody would opt in or what their particular cost would be going into the Medicare prescription payment plan. I can share that technical document with you, Tiara. It's very technical, but I'm happy to share it with folks if they want to see that. More importantly, I think there's those examples, and those examples really make it easier to understand how that math works.
Thank you. All right, we have 1 minute, so we have one last question. If a patient unenrolled from the Medicare prescription payment plan after filling a medication at the pharmacy, is the full amount due to the plan at that time?
It might have to do with when they unenrolled or opted out of the prescription payment plan. When they opt out, at that point in time, they would have to owe the whatever is remaining on the balance. And so it would depend on like when their prescription was dispensed and when that payment, they opted out and that payment was due. So it might be different depending on different circumstances and timing. But they would owe the balance amount if they opted out.
Okay, that makes sense. That makes sense. Kristi, this has been very helpful. We thank you and the Centers for Medicare and Medicaid Services for joining us today. We absolutely appreciate your time. We will be sure to send out the resources that you've provided with this presentation. And we encourage you all to complete the brief survey that you'll receive after this webinar. It does help us to ensure that we continue to provide helpful information and content to you. If you sent a question in the chat that we did not get to, we will be sure to post answers online. If you have any questions, please send us a message. And if you are not doing so already, please follow us on social media at Accessia Health. Again, thank you, and we look forward to your feedback. Kristi, thank you again.
Thank you so much. And thank you, everybody, for helping to spread the word.
Thank you.